My name is Todd Deutch, and I am a reproductive endocrinology and infertility specialist. Most people refer to us just as fertility specialists, and our specialty is helping people who are trying to build a family or improve their reproductive outcomes or chances, especially if they've dealt with poor outcomes or genetic issues in the past. I've always wanted to be a physician ever since I was a kid. My parents told me that when I was young, they took me to a baseball game and they asked me if I wanted to be a baseball player. And I said I wanted to be the physician for the baseball team. So why that was my answer, I don't know. I love working with patients. I love treating patients. I love the science and the technology and the constant improvement in what we do. So I think all of that goes into my desires to be a physician. I trained at University of Chicago, so it's special to me because I've been here for a long time. I did my residency here. I know the staff extremely well. The chairman is a very kind, amazing person, fantastic physician, incredibly patient-centered, and has built a department where that just kind of infiltrates down through the entire department. And I love being part of a department that's innovative, research-based, but yet incredibly patient-focused. My philosophy is to always put patients first. My favorite thing to do is to talk with patients and help understand what their needs are. I often tell patients that in fertility treatment, it's a little different than other sort of medical treatments where, for instance, if you're a cardiologist, you might come into your cardiologist and they might say you need a bypass or, unfortunately, you're not going to be here very long, where fertility treatment's not like that. And so fertility treatment's much more about options and what works for patients. And so understanding the patients and understanding the options and helping them to understand the options and what works best for them, and really that conversation and that back and forth, that's my philosophy, and that's what I love doing the most. I have had the experience of going through fertility treatment with my partner. It was challenging to be both a physician and also a supportive partner. I learned a lot through the process. I was in my fellowship, and so I was a fellow 1 minute with my white coat on and treating patients, and then taking my white coat off and sitting with my partner in the waiting room, waiting for her to be called, and then going for our ultrasounds and our treatments. So that was almost 20 years ago now. So I've learned a lot about not only that time period and those choices and how those affect you psychologically, mentally, emotionally, and how they affect a partner going through it, but also sort of the longevity of those choices. And so I think that brings a lot of understanding to the practice of fertility medicine, which is probably pretty unique, or I should say is unique, for most practitioners in the field.